Hello and welcome to YouTube channel HealthQ, the place where our mission is to motivate you and help you to move on to the brighter side of the health. In today's video, I am going to address the concerns of parents whose children experiences floppy muscle tone. Yes, I do talk a lot about spasticity management, I do talk a lot about dystonia, ataxia, etc. But rarely I speak about floppy kids. What about floppy kids? What about the muscle tone which is very floppy, there's no tension at all and they're just lying down? What can be done about that? So we are going to discuss all of them in today's video. So make sure to watch this video till the end. Let's begin. Friends, floppiness in the muscle means that the muscle don't have tension or tone at all in the body. That means if I'm holding my hand, this hand is being able to stay in this position because there is certain level of tension that is present in my muscles. Now just imagine that I lose those tension. I just don't have that strength, that power to hold this muscle. What will happen? It will fall down. It's floppy. Just similar to this baby, as you can see. If I'm lifting, there's no tension present in this muscle. So the leg fell down. This is exactly what happens in a floppy child. Now, a floppy child mostly is a child who have condition like Down syndrome, or else who have recently developed a brain insult. Maybe it could be due to a brain infection or else an injury to the brain, right? And sometimes certain genetic disorder also gives symptoms of floppiness. And children who are dystonic will also show some symptoms of floppiness, which means certain group of muscles would be very tight, very stiff, but certain group of muscle will just not have any tone at all. So what I'm going to do in today's video is I'm going to show you what are the things that you can do in order to develop certain level of tone in these muscles. So make sure to follow. So friends, whenever we are working on a floppy child or else the muscles which are not having any tone, the idea is to first stimulate the muscles or activate the muscles. Second, the idea is to give lot of joint compression or pressure over the joints so that the proprioceptors or the nerve receptors which are present in the joint gets activated, gives lot of joint position sense. And the third is development of direction or giving the direction to this muscle in what direction you should go, right? So these are the three common goals or ideas that we have in mind when we are working with a floppy muscle group or else a floppy child. Okay, so what is the number one thing that you need to do if the child's muscle is very floppy? As I said, stimulation. We need to stimulate these muscles, these nerves. Now how we can stimulate that? Number one way is to give lot of exposure or lot of stimulation with the help of different textures. You see here I have taken certain objects which are of different textures. So this is a smooth but at the same time an uneven texture, which is like a Turkish towel. So this is a little hard textured brush. Then I have taken a little rough surface like this, and also this is a rough texture of tissue. Now why all these things are needed? What we are trying to do, we are trying to stimulate the sensory nerves. When you are stimulating the sensory nerve, it will take the message to the brain will get activated and will give a response back which is of muscle contraction, right? That's what we are trying to achieve here. We want these muscles to work, we want these muscles to contract. In order to do that, it's important to stimulate these muscles. So all you need to do, just take these different textures and just for say let's say 10 to 15 repetition, repeatedly stimulate these muscles. You can cover all the areas or else you can focus only on the areas where you feel the muscles are very floppy. You can do here as well. Stimulate here. Like that. Once done, you take another surface and then stroke gently. So this is the way to stimulate a nerve. This gives a sense of proprioception or pressure or it activates the brain to send back the signals. Then you can take this. All you need to do is just for 10 to 15 times do this and you're good to go. And then last one. Alright, so this was about the stimulation. Make sure to do the stimulation for at least 10 to 15 stroke by each object and do this daily. By doing this, you would be able to see certain improvement in the functional activity of the child after 1 or 2 months. Again, how much you want to increase the dose depends on a lot of factors, and that's why you need an expert's help. So make sure to seek a physiotherapist help before starting all of these activities. So this was activity number 1. Let's move on to activity number 2. So the next activity that we have to do is joint compression. Now this I have shown in many of my videos, but again I'll show you. You need to make sure that you are compressing the joint against each other like this for 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and relax. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. Then here 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then you will compress here 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and relax. Similarly, you have to do for hands as well. So make sure to give compression to all the fingers, all the wrist and shoulder region as well. This is the second activity that you need to do. Again, make sure to do this for 10 to 15 repetitions for almost all the joints of the limbs, legs and hands. Okay. After that, the third thing that you will do would be compression again. So for this, make sure to lie down, make sure to make your child lie down on the tummy. You can use hand or else a pillow Now this might scare you, but trust me, nothing will happen. You need to put this pillow over the baby and you need to just give some gentle compression like this. Okay, don't push so hard that the baby gets choked. It should be very gentle, but it will be very soothing for the baby. You can use a physio ball, you can use a pillow, and even you can use a hand if the baby is very small. Just give pressure. This compression like this will also activate tone in the body. Similarly, you have to also practice some weight bearing. So let's say baby is too small, right? Then you should practice weight bearing over the hands by placing a pillow like this. Make this hand down and put pressure on the hand and let the child spend some time with pressure over it. Let it be there for 10 to 15 counts and relax. Again pressure 10 to 15 counts and relax. Again pressure 10 to 15 counts and relax. Very similarly, you have to make sure that you give pressure on the leg as well. So make sure to make the child sit with hand support over the spine. The child should put pressure on the leg, right? And then putting this pressure on the leg by your hand, encourage the child to get. Okay, make sure to consistently be supportive to the child. But when the child does this, there's a lot of weight bearing that is happening that will help the child to develop more muscle tone. You can do this for 10 to 15 repetitions. Then relax. So friends, these were 4 important tips to improve muscle tone among floppy children. I hope you found this video helpful. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.